Everyone talks about the massive weight loss, but nobody prepares you for the hidden physical reality. You finally get your prescription, you take that first weekly shot, and then it hits you. You find yourself staring at your computer screen on a Tuesday afternoon, feeling completely unable to function. You are experiencing the hidden GLP-1 side effects nobody warns you about at the clinic. I am Dr. Babar, a board-certified diabetes specialist from the Royal College of Physicians, London. And today we are going to uncover the hidden side effects of GLP-1 and talk about their countermeasures. Your body is not rejecting the medication. Your medical team simply forgot to hand you the survival manual. Today we are going to fix every single hurdle from the stomach paralysis to the heavy brain fog. But you need to pay close attention and stay with me until the end, because right around month 4, this medication triggers a silent physical transformation that can permanently age your body by 20 years if you do not block it right now. Let us start with the intense nausea that can strike shortly after your injections. A day or two after your injection, you might find yourself lying on the bathroom floor. You feel a constant queasiness that makes you avoid eating entirely. Even when you are starving, food just seems completely wrong. Almost half of all users experience this exact nightmare. Your doctor might have told you the medicine simply slows your digestion. That is only a tiny piece of the truth. The medication actually travels directly into your brainstem. It activates a very specific nerve center called the area postrema. This is your body's built-in alert system for nausea. At the exact same time, your stomach essentially becomes a paralyzed traffic jam. Food just sits there without moving forward. Your stretched stomach sends panic signals up your vagus nerve right into that activated brain center. Before we fix this, tell me in the comments below where you are watching from and how long you have been experiencing these digestive side effects. If you are finally getting the answers you have been looking for, please subscribe to the channel and hit the notification bell so you never miss these medical updates. Now we will shut down that nausea signal. You cannot rely on generic advice like eating crackers or drinking plain water. You need a highly specific clinical protocol. First, you must take 500 milligrams of powdered ginger extract exactly 30 minutes before your biggest meal on the day you take your injection. This specific compound directly calms those panicked nerve signals without fighting against your medication. Next, you must drink exactly 500 milliliters of an electrolyte fluid within 2 hours of your shot. Hydration stops the dehydration cycle that makes your nausea much worse. You also must change the actual physical mechanics of how you eat. Because your stomach is acting like a paralyzed muscle, you cannot drop a heavy meal into it all at once. You must eat very small portions spread evenly across your entire day. Even more importantly, you must chew every single bite of food until it becomes completely liquid. Your mouth must do the heavy mechanical breakdown because your temporarily paralyzed stomach currently cannot do its job. Do not touch any heavy or fatty foods for at least 2 days after your injection because your system simply cannot process them. This daily routine will help you survive the initial shock of the medication and get your normal life back. But you are not out of the woods yet. While you are successfully managing that upper stomach nausea, a completely different physical blockage is quietly piling up in your lower digestive tract. As your treatment continues, this hidden traffic jam will bring your entire system to a painful stop. That hidden traffic jam is severe constipation, and it becomes a massive roadblock as your treatment progresses. You suddenly feel a constant, uncomfortable pressure stretching your stomach all day long. You stop wearing your favorite fitted clothes because the bloating becomes incredibly severe and noticeable. You sit through important work meetings feeling completely distracted and deeply uncomfortable. You keep running to the restroom hoping for some quick relief, but absolutely nothing happens for 4 or 5 days straight. The mental frustration and the silent social anxiety become incredibly exhausting to deal with. Your digestive system is not just moving a little bit slower than normal. The medication has forced the muscular walls of your intestines to completely stop contracting. Picture a massive highway traffic jam where nobody is moving an inch forward. Because the waste is trapped inside your colon for way too long, your body aggressively absorbs all the water out of it. Everything inside becomes hard and completely dried out. This is a severe mechanical freeze that requires a very specific and targeted mechanical fix to get things moving. You need to force that smooth muscle to start working again right now. First, you must take exactly 10 grams of psyllium husk mixed with 500 milliliters of water in the morning. Do this exactly 30 minutes before you eat anything. This creates a special gel that traps moisture inside your digestive tract. Second, you need to take 400 milligrams of magnesium oxide right before you go to sleep. Taking it at night is the secret trick because it forces your colon muscles to contract while you rest. Just make sure you take the magnesium at least 2 hours away from your weekly injection. Finally, you must completely change your daily hydration habits. You need to keep a large water bottle with you at all times, wherever you go. You must continuously take small sips of water throughout your entire day, even if you are only eating very small amounts of food. Constant sipping provides a steady stream of hydration that stops your body from drying out your colon. Taking extra fiber without this constant flow of water will actually make this massive traffic jam much worse. Once you clear this painful blockage, you might think the absolute worst part is finally over. But this severe digestive freeze quietly triggers a completely different nightmare deep inside your cells. Because your body is struggling to process food properly, your actual energy factories are slowly starving to death. You are about to hit a devastating physical wall that makes simply getting out of bed feel absolutely impossible. You will feel totally drained of life. Let us talk about why your muscles suddenly feel like heavy lead and how to survive this brutal energy crash. As your treatment progresses, that severe digestive freeze forces your daily eating to drop significantly. You suddenly hit a massive physical wall that feels incredibly heavy. This is not just feeling a little bit sleepy after a long day at the office. You find yourself completely unable to finish a normal afternoon work meeting without losing your focus. Your brain feels wrapped in a thick, heavy fog. If you are a parent, you realize you have zero strength left to play with your children after school. Your legs feel like heavy concrete blocks when you try to walk upstairs. Your doctor might simply say you are tired from eating less food. The real physical truth is much more serious than that. Your body is experiencing severe cellular starvation. Because your appetite is completely suppressed, you are running on a massive calorie shortage. Your liver normally stores a special backup fuel called glycogen to keep you going. That backup fuel is completely gone now. To protect you from starving, your brain actually turns down your internal metabolic engine to survive. Your cells literally do not have the basic chemical fuel they need to keep your eyes open. We have to shock your cellular energy factories back to life immediately. You cannot wait until you feel hungry to eat something. You must consume 25 grams of whey protein isolate mixed with 40 grams of pure dextrose sugar. You must drink this exact mixture within 15 minutes of waking up every single morning. The simple sugar instantly refills your empty liver fuel tanks without making you feel nauseous. The high-quality protein strictly protects your muscles from breaking down. You must also take 200 milligrams of a B-complex vitamin with this morning drink. This specific vitamin forces that new sugar directly into your cellular engines to create instant physical energy. You must never let your daily food intake drop below 1,200 calories. If you starve those cells for too long, this profound daily weakness becomes something much worse. This heavy fatigue is actually the very first warning sign of a truly terrifying physical change. While you feel totally drained on the inside, your body is quietly cannibalizing its own vital tissues on the outside. This silent destruction leads to a shocking, visible transformation that makes people look 20 years older in just a few short months. Let us uncover exactly what is happening to your face right now and how to stop it completely. As your rapid weight loss really begins to accelerate, that profound energy drain reveals its truly devastating physical cost. You look in the bathroom mirror one morning and suddenly feel completely unrecognizable to yourself. Your cheeks look entirely hollow and deflated. Your jawline is prominent, but the skin hangs loosely around it. Friends might gently ask if you are feeling overly stressed or sick because you look 10 years older in your recent photographs. You stop taking personal selfies entirely because the emotional distress becomes incredibly overwhelming for you to handle. If this raw honesty is helping you feel less alone today, please gently tap the like button so this video can reach others who are secretly struggling in silence. People call this the Ozempic face, But the actual medical truth is far more dangerous than simple cosmetic changes. Because your body is starving for energy, it aggressively breaks down your valuable skeletal muscle to survive. Clinical data from the major Step 1 trial showed patients losing over 13% of their total lean muscle mass. Losing 10% of your muscle mass is the biological equivalent of aging 20 full years in just 12 short months. Your internal protein building pathways have completely shut down. Your body is quite literally eating its own foundation to keep you moving forward. We have to forcefully stop this rapid muscle destruction right now. First, you must consume 1.6 grams of protein per kilogram of your ideal body weight every single day. You must divide this total amount into 4 equal meals spaced 3 hours apart. Second, you must take 40 grams of whey protein mixed with 5 grams of creatine monohydrate within 30 minutes of finishing a resistance training workout. Doing this 3 times a week forces your muscle building signals to turn back on completely. To fix that hollow, sagging face, you must start a highly specific skin recovery protocol immediately. You must consume 15 grams of low molecular weight collagen peptides every single morning. You need to take this collagen with 50 milligrams of vitamin C to force those building blocks directly into your skin tissues. Finally, you must apply a 20% topical vitamin C serum to your cheek and jaw areas twice a day. This strict routine protects your skin elasticity while the underlying fat melts away. Rebuilding your physical foundation will bring your youthful face and strength back to life. But while you are successfully saving your outer muscles, a highly concentrated chemical storm is brewing deep behind your right ribs. By month 6, this silent internal storm creates a sudden medical emergency that could put you in the hospital if you ignore the warning signs. Let us look closely at exactly what is failing inside today. As your treatment progresses and the weight continues to drop, a hidden chemical change reaches a highly critical breaking point. You might sit down for a normal dinner with your family and eat something slightly heavier than usual. 30 minutes later, a sharp, agonizing cramp strikes directly under your right ribs. This intense pain radiates straight through your body into your right shoulder blade. You simply cannot find a single comfortable position to safely sit or stand. You might start vomiting, but the severe pain does not fade away at all. This is not just simple indigestion from eating a heavy meal. This is an acute gallbladder attack, and it requires immediate medical attention. When you lose a massive amount of weight very quickly, the chemical makeup of your digestive fluid changes drastically. At the exact same time, the medication severely weakens your gallbladder muscles, making them contract 30 to 40% less than normal. Because the fluid sits completely still for too long, it turns into sharp, solid, crystalline stones. According to the official FDA safety data, this specific medication increases your risk of developing these painful stones by almost 400%. Compared to taking nothing at all. Unlike your earlier stomach issues, this specific complication does not just go away on its own. You must memorize these 4 exact warning signs to protect yourself from dangerous complications. First, watch for severe pain under your right ribs lasting longer than 30 minutes. Second, notice any sharp pain shooting between your shoulder blades. Third, look out for sudden vomiting paired directly with severe upper stomach pain. Fourth, check for any fever accompanying these painful abdominal cramps. If you experience any of these 4 exact signs, you must stop your weekly injections immediately. You must visit an emergency room or an urgent care clinic to get an abdominal ultrasound within 24 hours. To actively lower your overall risk during these critical months, you must strictly keep your daily fat intake under 30 grams per meal. Following these strict boundaries will safely guide you past the most dangerous physical trap of this entire journey. But surviving these intense physical side effects is only half the battle. You have been fighting this difficult war completely alone, quietly wondering if your body is just broken or if you are doing something terribly wrong. You are not broken, and you are definitely not failing at this. Let us talk right now about the missing survival manual your medical clinic completely forgot to give you, and exactly why none of this is actually your fault. You have now safely navigated the most dangerous physical complications of this intense medication, but I want you to stop and listen to me very carefully right now. If you are struggling with any of these brutal daily hurdles, your body is absolutely not broken. You do not lack personal willpower. you are not doing anything wrong. The modern medical system simply handed you an incredibly powerful chemical tool, but completely forgot to give you the actual survival manual. They wrote your prescription and sent you home to figure out the painful reality all by yourself. Think about the overwhelming physical journey you have been forced to walk through. You survived the intense brainstem nausea that ruined your mornings. You fought through the severe lower digestive traffic jams that made you feel constantly bloated. You battled the profound cellular starvation that drained every single drop of your daily energy. You actively protected your vital muscle tissue and your facial structure from rapid aging. You learned exactly how to monitor your internal organs for dangerous crystal formations. That is an enormous amount of physical stress to handle completely alone in the dark. Millions of people abandon this life-changing medication every single month because they feel entirely defeated by these exact symptoms. They mistakenly believe their own bodies are actively failing them during this incredibly vulnerable time. The real truth is that these medications completely rewrite the basic rules of your internal biology. When you suddenly change the biological rules without changing your daily survival strategies, your delicate system naturally crashes and burns. But now you finally hold the exact clinical blueprint to control those hidden biological reactions. You possess the precise knowledge to stop the stomach paralysis, feed your starving cells, and rebuild your physical foundation. You are finally back in the driver's seat of your own long-term health journey today. You have transformed a terrifying list of random medical side effects into a clear and completely manageable roadmap. You know exactly what to expect and exactly how to beat each obstacle before it even starts. But having this powerful medical knowledge in your hands is only the very first step. To truly master this physical transformation, we need to focus on your specific daily battle right now. We need to identify exactly which hidden hurdle is currently standing in your way today. Let us figure out your next step together right now so you never feel alone again. You have the clinical tools to beat these hidden obstacles today. But somebody you deeply love might be sitting in their kitchen right now, secretly crying because they feel completely broken by these exact same physical side effects. Please send this medical manual to them directly. It takes only 2 short seconds of your precious time, and it might literally save their long-term physical health and their daily sanity. While you are working incredibly hard to safely manage these intense physical reactions to your weekly synthetic injections, there is a massive biological secret most medical clinics never mention to you. You do not actually have to rely entirely on a plastic chemical pen to get these powerful metabolic signals. Your body actually possesses a hidden factory deep inside your lower digestive tract. This hidden factory is fully capable of manufacturing its own powerful natural medicine. This metabolic factory is run by very specific microscopic gut bacteria. When these unique bacterial colonies are healthy, they naturally suppress your daily appetite, stabilize your morning blood sugar, and melt away stubborn visceral fat. They do all of this heavy lifting without causing any of the brutal nausea or severe colon paralysis we solve today. But the highly processed modern American diet actively starves these exact bacterial colonies to death. By the time you reach normal adulthood, your natural internal hormone factory is completely shut down and completely broken. You can actively force your own body to turn this natural biological factory back on today. You simply need to feed those specific starving bacteria the exact rare fibers they desperately crave to multiply and thrive. There is a highly specific nutritional protocol that rapidly grows these specific colonies in just a few short weeks. I recorded a complete clinical breakdown showing you the exact daily foods you must eat to multiply these crucial bacteria and force your body to make its own natural medicine. Click the video on your screen right now to permanently unlock your natural metabolic factory, and I will see you immediately over there.